Okay, I'm going to get started. So good evening, everyone. My name is Jasmine Anderson. I am an immunization education specialist for the Partnership for Maternal and Child Health of Northern New Jersey. Thank you all for joining me today in honor of National Infant Immunization Week. This week highlights the importance of vaccinating children ages 2 and younger against vaccine preventable diseases. And so in today's webinar, we will review all of the vaccine preventable diseases, um, all the vaccines, all the recommended vaccines that babies receive in their first year of life, as well as the diseases that they protect against. So this activity is supported in part by the New Jersey Department of Health Vaccine Preventable Disease Program. Participants will be able to explain the purpose of well baby visits, discuss why vaccines are important and for babies, distinguish between childhood vaccines, and summarize childhood vaccine preventable diseases. So there are currently outbreaks happening with vaccine preventable diseases, in particular with measles. So far to date, 125 cases of measles have been reported in the United States in 2024, including cases in New Jersey. There's actually a huge outbreak happening in Chicago, which is why Illinois is a little bit darker on the map compared to other states that have reported cases. 83% of those cases were individuals who were either unvaccinated or their vaccination status is unknown, and most of the cases were made up of children under the age of 5. We also see that a good number of cases were cases in adults. Those adults were more than likely not vaccinated or under vaccinated against measles. And so this really underscores the importance of childhood immunizations, especially for measles. There are also pertussis outbreaks taking place around the world. This article was published last week. The United States has reported some cases and outbreaks. New York City actually experienced an outbreak between this past October and earlier this year, with more than 200 cases of pertussis being reported in young children. And so this is an excerpt from the article. It's recommended that anyone seeing a new baby should have a Tdap booster, which protects against pertussis, and pregnant people should get a Tdap booster with each pregnancy to offer their babies early protection. And so we'll discuss a little bit more about pertussis and Tdap a little bit later in the presentation. So I'll begin with discussing well baby visits, why babies should get vaccinated, the recommended immunization schedule for children, and vaccines for families and caregivers. So, a well baby visit is a visit with your baby's pediatrician for the purpose of ensuring your baby is growing and developing normally. So, you can expect to track your baby's growth and developmental milestones, discuss any concerns you may have about your baby's health, and you can expect that your baby will receive vaccinations to prevent serious illness. This is the schedule of the well baby visits in year 1. Your baby will see their pediatrician at least 7 times in the first year, and your baby will receive at least one vaccine at each visit. There are 3 reasons why babies should get vaccinated. Number 1, vaccines can save your baby's life. All of the vaccine preventable diseases can be fatal for your child or can have permanent effects on your child. Vaccines are over 90% effective in preventing serious illness, complications, and death. Number 2, vaccines strengthen your baby's immune system. Babies' immune systems are extremely underdeveloped when they are born. Vaccines give their bodies a head start in developing effective immune responses to illnesses. And number three, vaccines protect everyone around you and future generations. When we get vaccinated, we help prevent the spread of harmful diseases, especially to those who may not be able to get vaccinated, like those who are immunocompromised. Additionally, vaccines have led to some diseases being eliminated in some parts of the world, meaning that those diseases are not prevalent in certain parts of the world. And vaccines have led to the complete eradication of the smallpox disease. So thanks to the vaccination efforts of the previous generations, we no longer have the threat of smallpox illness, nor do we have to get vaccinated against smallpox because it no longer exists. This is the recommended immunization schedule for children ages birth to 6. The CDC, American Academy of Pediatrics, and the American Academy of Family Physicians developed this schedule for all of the recommended childhood vaccines and when they should be given. It is essential to follow the recommended immunization schedule for several reasons, and we'll touch on those in the next slide. But the most important reasons are that one, this schedule was designed considering the ideal timing for when children should be protected. And number two, it ensures that children receive both early and long-term protection. And so the way that you would read the immunization schedules, you'll see across the top, there are ages. And then across the left here, down the left here, you see that these are the vaccines that are recommended. And so each bubble represents the dose for each vaccine and at what age each dose is given. If you see a bubble that spans across several ages, such as the third dose of the hepatitis B vaccine, it means that children can get that dose between any time during this time period. But it is highly recommended that you vaccinate your child sooner rather than later. There are also vaccines. Vaccines can be administered in combination shots, and so that your child may get 1 to 2 shots that protect against 5 diseases. And so you can see here on the schedule that there are some doses that are administered at the same time at each different visit. And so some vaccines that are typically combined together are the following: DTaP, Hep B, and polio. DTaP, polio, and HIV, DTaP and polio, DTaP, polio, HIV, and hepatitis B. And then the last combination vaccine is the MMR and varicella vaccine. Varicella protects against chickenpox. With that particular combination vaccine, there's a higher chance of seizures in children and high fevers. And so it's best that children under 4 get the MMR vaccine and the varicella or chickenpox vaccine separately. So why follow the recommended immunization schedule? As I mentioned, ideal timing, the schedule is based on how a child's immune system responds to vaccines at various ages and how likely a child is to be exposed to the particular disease. Number two, it prevents complications. Delaying vaccines could lead your child vulnerable to disease when they are most likely to have serious complications. Number three, early protection. It's best to vaccinate your child before they are exposed to dangerous diseases. If you wait until you think your child could be exposed, like when they start daycare or during a disease outbreak, there may not be enough time for the vaccines to work. Most vaccines take 2 weeks to work, where your body takes 2 weeks to develop antibodies. And so if you get your child vaccinated during a disease outbreak, there definitely may not be enough time. Number four, best protection. Children won't be protected from all of these serious diseases until they get all of the recommended vaccine doses. Number five, long-term protection. Many vaccines offer lifelong immunity against diseases. In addition, maternal antibodies and breastfeeding don't provide enough protection. So many vaccines can be passed, antibodies can be passed to your child during pregnancy and during breastfeeding, but that protection isn't enough. And then number six, spreading illness. Children who are not vaccinated on schedule are not only at risk of getting sick themselves, but they can also spread illness to others who aren't protected, like other children in their age group, newborns who are too young to get vaccines, and people with weakened immune systems. So, newborns do not have a fully developed immune system, which makes them extremely vulnerable to infections. So, family members and caregivers should be up to date with vaccinations to help protect the newborn, especially they should be up to date with their flu and Tdap vaccines. Tdap protects against whooping cough or pertussis. Mom should have gotten Tdap and flu vaccines during pregnancy to pass antibodies onto the baby for those first few months of life. But sometimes that doesn't happen. Um, and so, for family members and visitors of babies, if you're not up to date, you should get the Tdap and flu vaccines at least 2 weeks before meeting the baby. As I mentioned, the body takes 2 weeks to develop antibodies after vaccination, and so please make sure that you are up to date with those vaccines in particular, because those diseases can be extremely serious for babies. So now we'll dive into some vaccine basics. We'll discuss what vaccines are, how they work, common side effects, vaccine ingredients, combination vaccines, and then New Jersey vaccine requirements for preschools, daycares, and early childhood centers. Vaccines are safe, simple, and effective tools that protect us from harmful diseases or pathogens before we encounter them. So, pathogens are viruses like the flu or COVID-19, or bacteria like tetanus or meningitis that can cause disease. So, this video explains exactly how vaccines work. If you can't hear the audio, please let me know in the chat. Thank you.
When your child gets a vaccine, an amazing thing happens. Just like a teacher, the vaccine gives your child a lesson. The immune system gets to work right away, learning what to do if your child is exposed to harmful germs. All of us are exposed to germs every day. Some might cause a cold or a minor illness, but then there are more dangerous viruses and bacteria that can make children very sick. Diseases like measles, diphtheria, and polio used to sicken and kill thousands of children. That's why it's important to get vaccinated, so your immune system will know what to do. Here's how that works. Vaccines contain either an antigen, a piece of the germ, or some instructions that tell us how to make the antigen. They teach your immune system to produce antibodies to get rid of the virus or bacteria. Then, those antibodies remember what to do if your child is exposed in the future. Vaccines can work in a few different ways. In some vaccines, the antigen is a virus that has been weakened. This means it will not be able to reproduce in your body to make you sick. But it does a great job of teaching your immune system to be ready for the real thing in the future. Other vaccines use a virus that has been killed, a tiny piece of a virus or bacteria, or a weakened form of a toxin, like the kind produced by the bacteria that cause diphtheria and tetanus. Same thing, it can't make you sick, but it teaches your immune system to recognize the germ. Getting one or more doses of a vaccine later on gives the immune system a memory boost, so it remembers what to do. The recipe for most vaccines is pretty simple. Besides the antigen, some vaccines contain aluminum salts, which help make the antigen work better, so children can get a lower dose. The amount of aluminum in vaccines is small, much less than your child gets from everyday food and water. Some vaccines also include a preservative to keep germs out and tiny amounts of other ingredients, all very safe. After your child gets a vaccine, their arm may feel sore or they may get a fever. That's a sign your child's immune system is getting stronger. After the vaccine does its job, it leaves the body and is gone. A week or two later, your child's immune system is better able to protect your child. Remember, vaccines have been given to millions of children and teens. They are closely studied, and we know they are safe and effective. In fact, vaccines work so well, most reduce your child's risk of getting these diseases by 90% or more. It's an amazing way to protect your child so they can stay healthy and safe.
So any vaccine can give side effects, and side effects will vary depending on the vaccine given. The side effects on this slide were found to be the most common vaccine side effects in children. Most side effects from vaccines are mild and will resolve within 2 to 5 days. The side effects usually occur within 12 hours of being vaccinated. Serious reactions to vaccines are rare, but pediatricians should be called if your child or baby is exhibiting any symptoms that may concern you. And you always want to consult with the pediatrician before giving any pain reliever or fever reducing medication after vaccination. As the video mentioned, every ingredient in vaccines serve a purpose. They do one of the following. They provide immunity, they keep the vaccine safe and long lasting, or they make the vaccine more effective. But every ingredient in the vaccine is safe and has been proven safe. So I mentioned combination vaccines when we went over the pediatric immunization schedule. Combination vaccines take two or more vaccines that can be given individually and puts them together into one shot. So at a doctor's visit, your child may only get 2 or 3 shots that protect them from 5 diseases instead of 5 individual shots. There are several benefits for combination shots for children and parents. For children, it means fewer shots, less pain and discomfort, and on-time protection. For parents, it means fewer visits to the doctor, less hassle and costs with fewer visits, and then less time off work and from family activity. Oftentimes, parents ask to space out vaccinations. However, spacing out vaccinations could mean that your child is unprotected. It could mean more visits to the doctor and repeated pain or discomfort for your child. And so combination vaccines just kind of eliminate all of those issues. New Jersey has a list of required immunizations for children to attend preschools, daycares, and early childhood centers. This is available on nj.gov. You can also just type into Google NJ immunization requirements, daycares, and it'll come up. And so it lists the vaccines that children need to attend preschools, early childhood centers, and daycares, and which dose the child should have depending on their age. And so we're actually going to dive deeper into all of these vaccines in the next portion of the presentation. So now we're going to discuss all of the first-year vaccines and the diseases that they prevent. So babies receive their very first vaccine within the first few hours of birth, which is the hepatitis B vaccine. Hepatitis B is a viral infection that attacks the liver and causes hepatitis, which is swelling of the liver, cirrhosis, or liver cancer. There may be no symptoms, or symptoms can include fever, headache, weakness, vomiting, jaundice, joint pain, fatigue, loss of appetite, and dark urine. Many people do not know that they have hepatitis B. In fact, hepatitis B infection is known as the silent epidemic because many infected people do not experience symptoms until decades later when more serious issues develop. So hepatitis B can spread through contact with blood or body fluids, which means that mom can pass hepatitis B to the baby during birth. Risks of hepatitis B infection include hepatitis, which again is inflammation of the liver, cirrhosis, which is severe liver disease, liver cancer, and death. The current recommendation is that babies receive 3 to 4 doses of the Hep B vaccine, depending on the hepatitis vaccine brand that they get. And so they'll receive 1 dose at birth, and then a second dose 1 month at 1 month old, one at 6 months old, and then for some people, for some children, one at 6 months of age. And so if you're thinking about getting pregnant, it is strongly recommended that you are up to date with your own vaccines, including hepatitis B, because the mom can unknowingly pass the hepatitis B infection onto the baby. So your baby will have a first week visit with the pediatrician 3 to 5 days after birth. No vaccinations are given during that first week visit unless your baby did not receive the Hep B birth dose. And so at that first week visit, your child will receive the Hep B dose, if not the Hep B birth dose, if they didn't receive it right after birth. The next visit after that is the 1 month visit, where your baby will receive the second dose of the hepatitis B vaccine. The next well baby visit is the 2 month vaccine, 2 month visit. Your baby will receive the first dose of the following vaccines: rotavirus, Hib, polio, pneumococcal, DTaP, and RSV. Some of these again can be combined. You just need to, I can go over those at the end of the presentation as well. But you can also discuss those that option with your pediatrician. And so let's dive deeper into these vaccine preventable diseases. Rotavirus is a viral infection that infects the lining of the intestines and causes severe diarrhea and vomiting. Symptoms include fever, watery diarrhea, vomiting, and stomach pain. It can spread through the mouth and can survive on objects for several days. The CDC states that good hygiene is important, but it is not enough to control the spread of rotavirus. Risks of rotavirus include loss of body fluids and dehydration, which can be fatal. The current vaccine recommendation is that babies receive 2 to 3 doses of the rotavirus vaccine beginning at the 2 month visit. There are 2 rotavirus vaccines that are authorized for use, and the doses your child will need depend on the vaccine brand that your child receives. The second dose will be given at the 4 month visit, and if a third dose is required, it will be given at the 6 month visit. Next, Hib, which is short for Haemophilus influenza type B, is caused by a bacterium that infects the lining of the brain, causing meningitis, which is the swelling of the brain and spinal cord. Symptoms include fever, headache, stiff neck, nausea with or without vomiting, eye sensitivity to light, confusion, poor eating and drinking, low alertness, and irritability. HIV can spread through respiratory droplets, and risks include meningitis, sepsis, epiglottitis, which is an inflammatory condition of the flap of skin that's at the top of your throat, arthritis, cellulitis, which is a skin infection, pneumonia, and death. The current vaccine recommendation is that children receive 3 to 4 doses, beginning at 2 months and one at 4 months of age. Some children may get an extra dose at 6 months, and then all children get the final dose of the HIV vaccine at 6 months of age. Polio is caused by a virus that can infect the spinal cord and cause lifelong and fatal paralysis. There may be no symptoms, or symptoms can include sore throat, fever, nausea, headache, and stiff neck. It can spread through the air, direct contact, the mouth, and stool. Risks include permanent paralysis and death. It is recommended that children receive 4 doses of the polio vaccine beginning at 2 months, a dose at 4 months, a dose at 6 months, and then a dose at age 4. Pneumococcal disease is caused by a bacteria that can cause ear, lung, blood, and brain infections. There are 2 main types of pneumococcal disease, pneumococcal pneumonia and pneumococcal meningitis. Symptoms depend on the affected body part. There may be no symptoms, or there may be symptoms of pneumonia, which include fever, chest or stomach pain, decreased appetite, chills, breathing hard or fast, vomiting, headache, and fussiness. There may also be symptoms of meningitis, which include fever, cold hands and feet, refusing food, vomiting, drowsy or unresponsiveness, rapid breathing or grunting, pale, blotchy skin, unusual cry or moaning, tense or bulging soft spot, stiff neck, and sensitivity to light, convulsions, and seizures. Um, Risks of pneumococcal disease include bacteremia, which is when you have bacteria in your blood, empyema, which is the infection of the lungs and the chest cavity, sepsis, meningitis. Sometimes antibodies don't work, and also death. About 1 in 12 children who get pneumococcal meningitis die of the infection, and pneumococcal pneumonia kills about 1 in 20 people who get it. So it is extremely dangerous and can be fatal for a lot of children. It is recommended that children receive 4 doses of the pneumococcal vaccine, beginning at 2 months, a dose at 4 months, a dose at 6 months, and then the final dose at 12 months. Next, diphtheria. Diphtheria is caused by a toxin from a bacterium that makes it difficult to breathe and swallow. It attacks the heart, kidneys, and nerves. Symptoms include sore throat, mild fever, weakness, and swollen neck glands. It can spread through the air and direct contact. Risks of diphtheria include swelling of the heart muscle, heart failure, coma, paralysis, and death. Tetanus is a bacterial infection that is caused by a toxin that lives in the soil, and it causes lockjaw. So tetanus is the only naturally occurring vaccine preventable disease, and it does not spread person to person. It spreads through breaks in the skin, which include wounds, puncture wounds, and burns. Symptoms include stiffness in neck and abdominal muscles, difficulty swallowing, muscle spasms, and fever. Risks of tetanus include broken bones, difficulty breathing, and death. Next, pertussis. Pertussis, which is also known as whooping cough, is a bacteria that causes violent coughing fits. Symptoms include severe cough, runny nose, and apnea, which is when a person pauses and when they're breathing in their sleep. It spreads through the air and direct contact. Risks include pneumonia and death. And as I mentioned earlier, pertussis can be extremely dangerous, especially for newborns. So it is recommended that children receive 5 doses of DTaP, which protects against diphtheria, tetanus, and pertussis. It is a combination vaccine. And so beginning at 2 months, the child will start the vaccine series at 2 months and will get doses at 4 months, 6 months, 15 months, and at age 4. Adolescents will also receive an additional vaccine dose, and it's called Tdap at age 11, and that protects against the same diseases. It's just that the vaccine components, the amount of the vaccine components differ in Tdap versus DTaP. Next, RSV. RSV, or respiratory syncytial virus, is a common respiratory virus that causes mild cold-like symptoms. In other words, RSV is a cold virus. The virus infects the nose, throat, lungs, and breathing passages. It is the most common cause of hospitalization in children under the age of 1. And each year, in the United States, an estimated 58,000 and 80,000 children younger than 5 years of age are hospitalized due to RSV infections. And so we typically see RSV infections in late fall to early spring. RSV is extremely contagious. It can spread through respiratory droplets from coughing, sneezing, or even kissing from an infected person. So that means an adult that's infected with RSV can kiss a baby and pass RSV on to the baby. It can also spread from touching surfaces contaminated with the virus, as the virus can live on hard surfaces for hours. And so the current vaccine recommendation is that infants entering their first RSV season receive 1 dose of the RSV antibody, which provides RSV antibodies directly to the baby. The other option is that moms who are 32 to 36 weeks pregnant between the months of September and January receive 1 dose of the maternal RSV vaccine, in which case moms pass antibodies to the babies to provide the babies with those antibodies in the first few months of life. At the 4-month visit, children receive vaccines, the second dose of rotavirus, Hib, polio, pneumococcal disease, pneumococcal vaccine, and DTaP. At the 6-month visit, children are receiving the third dose of polio, third dose of pneumococcal vaccine, third dose of DTaP. And this is when children first get the COVID-19 vaccine as well as the annual flu shot. So seasonal influenza or flu is an upper respiratory virus that infects the nose, throat, and lungs. Symptoms include fever, muscle pain, sore throat, cough, and extreme fatigue. Flu spreads through the air and direct contact, and risks include pneumonia, bronchitis, sinus infections, ear infections, and death. A common misconception about the flu is that it is not a serious illness, especially for children and babies. However, that's not true. Children can develop serious complications from the flu. They can be hospitalized, and the flu can be fatal for children. In fact, there have been 142 pediatric flu deaths so far this current flu season, with the majority of those children being unvaccinated against the flu and ranging from ages younger than 6 months to 17 years old. It is recommended that everyone, including infants 6 months and older, receive one flu shot annually by the end of October. Flu viruses are constantly changing, and so the flu vaccines are reviewed each year and are updated based on the most frequently circulating flu strands from the previous flu season. COVID-19 is a disease caused by the SARS-CoV-2 virus, which causes mild to severe respiratory illness. Symptoms can include fever, muscle aches, sore throat, dry cough, headache, nasal congestion, fatigue, runny nose, diarrhea, vomiting, new loss of taste or smell, loss of appetite, or there may be no symptoms. It spreads through the air or direct contact. It can linger in the air for a long period of time. Risks include pneumonia, respiratory failure, blood clots, bleeding disorder, injury to liver, heart, or kidney, multisystem inflammatory syndrome, post-COVID syndrome, and death. And so the current COVID vaccine recommendations for babies are that babies 6 months and older receive 3 doses of the updated Pfizer vaccine or 2 doses of the updated Moderna vaccine. Either one is recommended, but it is not recommended to mix. It is not recommended to mix the vaccine doses. And so if your child starts with Pfizer, they should finish with Pfizer and they should continue getting Pfizer. Same thing with Moderna. And at the 12-month visit, children are receiving either the third or fourth dose of Hib, fourth dose of the pneumococcal vaccine, the annual flu vaccine, and then the first dose for measles, mumps, rubella, chickenpox, and hepatitis A. So measles is an extremely contagious viral respiratory infection that causes a rash and fever. Symptoms include rash, fever, cough, runny nose, and pink eye. It spreads through the air and direct contact. One person infected with measles can infect 9 other people. That's how contagious it is. One person can infect 9 other people. Those 9 people can each infect 9 people, and so it just continues to spread that way, and it can spread rapidly. Measles can also linger in the air for an extended period of time, even after an infected person leaves a room. Risks includes encephalitis, which is inflammation of the brain, fever, pink eye, pneumonia, and death. Mumps is a viral infection that causes puffy cheeks and swollen jaws. Symptoms include fever, headache, muscle aches, tiredness, loss of appetite, swollen glands under the ears or jaw. It also spreads through the air and direct contact. Risks include meningitis, encephalitis, swollen salivary or parotid glands, miscarriage during pregnancy, inflammation of testicles or ovaries, deafness, and death. And then rubella, which is also known as German measles, is another viral infection. Rubella can be extremely serious if a pregnant woman is infected with rubella. It can lead to miscarriages, stillbirths, premature deliveries, and birth defects. Rubella can spread through the air or direct contact. Symptoms include rash, swollen salivary glands under the jaw, fever, headache, tiredness, and muscle pain. So it's recommended that children receive 2 doses of the MMR vaccine, the measles, mumps, rubella vaccine, which protects against all 3 diseases, one at 12 months of age, and then the second dose at age 4. So there is a huge misconception about the MMR vaccine that it can cause autism. This is extremely false. The source of this misconception comes from a 1998 study that was found to be unethical and completely false. For that reason, the study was pulled from publications, and the doctor who published the study lost their medical license. Studies have shown and continue to show that there is no link between autism and any of the vaccines. So again, that is a huge misconception, but because of the publication of that paper, it has led to a lot of vaccine hesitancy, which people being hesitant to receive vaccines, and just a lot of misconceptions about vaccines and the link to autism. So chickenpox is a viral infection that causes an itchy rash of blisters and fevers. Symptoms include rash, tiredness, headache, and fever. It spreads through the air and direct contact. Risks include infected blisters, bleeding disorders, encephalitis, pneumonia, and death. It is recommended that children receive 2 doses of the chickenpox vaccine, which is called varicella, 1 dose at 12 months, and then the second dose at age 4. And then lastly, out of all of these diseases, we have hepatitis A. So hepatitis A is a virus that causes hepatitis, which is, again, swelling, inflammation of the liver. Hepatitis A is different from hepatitis B in that it is primarily caused by poor sanitation and personal hygiene, and it can spread by fecal-oral transmission. Symptoms may include fever, stomach pain, loss of appetite, fatigue, vomiting, jaundice, and dark urine. Children under 6 typically don't show symptoms, unlike adults and older children. And unlike hepatitis B, which can cause chronic illness, hepatitis A is more short term. Once a person recovers from hepatitis A, they can't be reinfected because their bodies now have the antibodies to fight off the hepatitis A virus. But we also have the hepatitis A vaccine, and it is recommended that children receive 2 doses of the hepatitis A vaccine 6 months apart at 12 months of age. However, children can start and complete the hepatitis A vaccine series between 12 and 23 months of age. And so now we'll wrap up this webinar with some more general vaccine information, including where to get vaccines, the Vaccines for Children program, which provides vaccines at no cost for eligible children, immunization records, how to make shots less stressful for children, vaccine FAQs that parents have, and then other vaccine resources. So here's where you can get your child or your baby vaccinated. Because these vaccines are recommended by the Advisory Committee on Immunization Practices, or ACIP. These vaccines are covered by all insurance companies. For those who are uninsured or underinsured, you can visit your local health department, a public health clinic, or a federally qualified health center, not health clinic, sorry, federally qualified health clinic to get vaccinated for free. And so the Vaccines for Children program is a federally funded program that provides vaccines at no cost. Vaccines are free, but some clinic sites may charge an administrative fee. No one can be refused vaccines if the administrative fees cannot be paid. That was something that was newly mentioned by the NJDOH this year. And so if you can't pay those admin fees, you cannot be turned away and your child can still receive those vaccines. And so to be eligible to receive a vaccine under the VFC program, your child must be under the age of 19, Medicaid eligible, uninsured or underinsured, or a Native American Alaskan Native. And so to get your child vaccinated under the VFC program, you can ask your doctor or pediatrician if they participate, and then you can also visit FQHCs, local public health clinics, or ask your local health department if they administer vaccines. It is extremely important to keep track of your children's immunization records and keep them up to date. Immunization records are needed for schools, daycares, colleges, extracurricular activities, traveling, adoption and fostering, and even when your child becomes an adult. You can keep and maintain your own copies of your child's immunization records. You can ask your child's doctor how they keep track. You can also ask them to enter the vaccine information into New Jersey's official immunization information system, which is connected to the Docket app, which is available for Android and Apple users. So the Docket app you can pull up on your phone, and it lists all of the immunizations that you have and that your child have, and then it lets you know if your child needs any doses. So the CDC has 9 tips that you can use to make shots less stressful for your child. Number one, do your research. It's good for you to know what vaccines your children are receiving, what diseases they're protecting against, and then also just reviewing any other vaccine information that you may have access to. Number two, asking for a sweet solution. Tasting something sweet can reduce your child's pain response, and so you can ask your child's pediatrician if your child can have a sweet solution. Number three, breastfeeding. If you can breastfeed, breastfeeding is a great way to calm and relax your baby. Additionally, because breast milk has a slight sweetness that can reduce your baby's pain response. Number four, you can ask for a pain relieving ointment or a spray, a cooling spray that can be applied to your child's arm or leg right before the shot. So that kind of lessens the pain that your child may feel after receiving the shot. Be honest and calm. Take the time to explain to your child if they are old enough to understand what's happening in simple terms and use calming language. We actually have a parent workshop where we use a children's book to explain how vaccines work. And so that children's book is actually an effective tool for children and for parents to learn about vaccines. And so if you are interested in learning more about the children's book, I can provide more information about that at the end of the webinar. Number six, bringing your child's favorite things. So anything that can comfort your child, or something that's pleasant, that can just pull their attention away. Number seven, distract your child by singing a song, calling their name, acting silly. Some children find fidget toys to be an effective way to distract them. So anything that can distract them just to pull their attention away from the actual shot. Number eight, supporting older kids. They still need support. Let them know that they are getting a shot, talk to them about it, help them take deep breaths and create distractions. Again, fidget toys are great, especially for older kids. And lastly, taking care of the child after the shot. Infants can be calmed by swaddling them. Small kids can be comforted with hugs. And then, mild reactions to vaccines are completely normal. And so I've actually attended a doctor visit with my niece when she received one of her very first vaccines as a child, and her crying really it set me off and it set her mom off, my sister. And so I know that that's something that can be shocking for a lot of parents, especially new moms. And so that's just initial shock for the baby. And so just making sure that you're just taking the extra step to comfort them can be extremely helpful. So here are some frequently asked questions that parents typically have about vaccines. Are vaccines safe? Yes. Millions of children receive vaccines every year, and studies continue to show that they are safe and effective. Do vaccines cause autism? As I went over, no, it's a common misconception. Studies and reviews continue to show no relationship between vaccines and autism. Why do vaccines start so early? The recommended schedule protects infants and children by providing protection early in life before they come into contact with life-threatening diseases. And children receive vaccinations early because they are susceptible to diseases at a young age. Will a vaccine make my child sick with a disease? The risk of disease from vaccinations that use weakened live viruses is very small. It is impossible to get the disease from any vaccine made with dead bacteria or viruses or parts of the bacteria or virus. Should my child get shots if they are sick? Children can usually get vaccinated even if they have mild illnesses. Of course, you should talk with your child's doctor and follow their recommendation regarding vaccination. Can shots be delayed? As I mentioned, anytime you delay a vaccine, you leave your baby vulnerable to vaccine preventable diseases. You leave other kids at risk to these vaccine preventable diseases and people who cannot be vaccinated, like immunocompromised people. Why are multiple doses needed? Depending on the vaccine, more than one dose will be needed to build high enough immunity or to boost immunity that can wane over time. Your child may also receive more than one dose to ensure that they are protected if they did not get immunity from the first dose, or to protect them against germs that change over time, like the flu. Is natural immunity better than vaccination? Nope. It is better to prevent sickness by getting vaccinated rather than getting an infection. And as I went over, a lot of these diseases have serious risks and complications. And so I don't think that it's really not the best thing to expose your child to those risks and complications, especially because a lot of those risks and complications can include death or have permanent and lasting effects on your child. Vaccines also lower the chances of diseases spreading. And lastly, if a disease is not present in my community, do I still need to vaccinate my child? Absolutely. Even if the disease is not in your immediate community, it may be present in other parts of the world, and your child can encounter disease from someone who traveled, or if they traveled themselves. That's exactly how we ended up dealing with these measles outbreaks. People have traveled to other parts of the world where measles is prevalent and brought them back, and then they started to spread among unvaccinated. Measles started to spread amongst unvaccinated people. So yes, getting vaccinated, even if the disease is not present, is absolutely essential. So there's a lot of misinformation and disinformation out there. So be sure that you're getting your information from trusted sources. Here's a list of websites that you can visit to get more in-depth information about vaccines, about the vaccine preventable diseases, things like that. So at this time, I will take any questions of if anyone has any. You can either unmute or you can write them in the chat. And in the meantime, I'll share my contact information. And so if you do have any further questions about immunizations, where to get immunizations or locating vaccines for children, clinic sites, you can contact me as well via phone or email. So if there are no questions, I will end the webinar here. Thank you all for joining me tonight. Again, it is extremely important that we are vaccinating our children against these vaccine preventable diseases. They are preventable. And so make sure that you are staying up to date with those vaccinations.